just an elephant. This is probably just an elephant in the corner of the room, but I was not hoping somebody else would ask the question. I'm of course somebody does it. In 2004, in I think this building actually, John Reed stood up and said it shall be the right of every adult citizen to have choice as to their place of death. It has been said by Edwina Hart in Wales, it has been said by Nicola Sturgeon in Scotland. And I think for all of us in the health community, that was a huge move forwards to help us when we went to visit primary care trusts, strategic health authorities. 5 years ago, we were lucky to see the guy who ordered biscuits, but now we get to see the director of commissioning or the director of nursing. And if you don't believe me, ask Mike Richards, because he's had the same experience. I think what worried a number of us about the draft manifesto was that it gives mothers a real choice over where to have their baby, to ensure that mothers can safely access the right care in the right place at the right time. Is it conservative policy to give patients and families a real choice over where to die at the end of their lives, to ensure that patients and families can safely access the right care in the right place at the right time?
It is, but we have certain things we need to do before we get there. It is, I'm afraid, simply stating the facts of the case that we are, where maternity services are concerned, it is a short and not that complex task to move from where we are to what is a simple risk-based assessment that leads to a tariff payment that then means that the mother can exercise choice and that money flows into their choice of maternity service provider. And of course it's very easy to set boundaries around it. We know that a mother is going to have a baby. It is not so easy to set a right to choice of place of death in relation to people with life-limiting illnesses. Understanding who this population are isn't as straightforward. Understanding what this money follows the patient system actually looks like isn't so straightforward. Developing the services out in the community is not so straightforward. So we're going to have to get there in stages. And indeed, we do need to contemplate what are the legal circumstances. Because, for example, if a mother goes home, the NHS has a legal obligation to provide maternity services to that mother in that house. Whereas the NHS doesn't have a legal obligation to provide services to people at home in the same way if they just choose to go home. So we've got a lot of bridges to cross. And I'm not trying to kind of bullshit you, Tom. I just think this is hard. And actually the fact that John Reed said it, and I know John, and John does believe in choice actually, it just didn't happen. And I think the main reason it hasn't happened, that 1 in 3 people feel they're exercising any choice, and the numbers of people dying at home have not shifted in the generality of the country in the way that we would have anticipated, is because some of those practical questions have not been tackled. So I think it would be fair for you to say to me, would such a right be exercisable at the point where we have put in place a payment by result system? Answer, I think we should, because from the patient's point of view, this clearly is a central aspect of the choices that they will want to make, and therefore any payment by result system must directly correspond and relate to that. But until we've got a payment by result system in place, it's very difficult to contemplate it happening.
I think that helps a lot, because I think the elephant was the emphasis on maternity means that I think we just want to be sure that there isn't a step back, if there's a change in government, from a real commitment to better end-of-life care. And I sense from your excellent presentation answers to the questions that there is.
No, we need to do this thing. And I hope if we were to be meeting in 10 years' time, that at least you would feel that where things weren't right, there were individual instances that went wrong, which we cannot ever eliminate, not systematic things that continue not to have been reformed and not going in the right direction.
Thank you.
Thanks, Mark. Thank you very much.